Hi friends, welcome to the channel The Nurse. So here is the new topic, that is forensic nursing. So forensic nursing recently added in our nursing curriculum. So we can expect in upcoming exams the questions from forensic nursing also we can expect. So in this video we will discuss around 30 multiple choice questions from forensic nursing. So and one more thing, uh, this topic we will more discuss about death and death related causes and all. So if anyone getting upset or any issues with these terms or these conditions, so don't watch this video. So but we need to study that. So we will go to our topic, forensic nursing multiple choice questions. And one more thing, if you want more questions from forensic nursing, we will upload it into our Android app. So those who are interested, they can watch it from our Android app, forensic nursing questions. So we'll go to our topic, forensic nursing multiple choice questions. So these questions are freshly made questions. So you cannot see it anywhere in Google or anywhere. And we are going to start. First question, which of the following is not included in four types of legal inquest procedure? Which of the following is not included in four types of legal inquest procedure? Police inquest, magistrate inquest, lawyer inquest, coroner inquest. Correct answer is option C, that is lawyer inquest. The legal inquest includes four types and it includes police inquest, magistrate inquest, coroner inquest and medical practitioner inquest. These are the four types of legal inquest. But in the scenario of India, we have two types of inquest. In India, now currently we have two types of inquest. They are police inquest and magistrate inquest. Previously, there were coroner inquest, but it is not currently present. So in India, two types of inquest procedure we have. Second question, magistrate inquest is held under section. Magistrate's inquest is held under section 114 CrPC, 155 CrPC, 176 CrPC, 189 CrPC. CrPC means Criminal Penal Code. Magistrate inquest is held under section. So correct answer is option C, 176 CrPC. Magistrate inquest is held under section 176 Criminal Penal Code. Next question. A surgical procedure that consists of a thorough examination of a corpse by dissection to determine the cause, mode and manner of death or to evaluate any disease or injury that may be present for research or educational purpose. A surgical procedure that consists of a thorough examination of corpse by dissection to determine the cause, mode and manner of death or to evaluate any disease or injury that may be present for research or educational purposes. Option A, post-mortem examination. Option B, autopsy. Option C, obduction. Option D, all of these. Correct answer is all of these. Surgical procedures that consist of a thorough examination of a corpse by dissection to determine the cause, mode, manner of death or evaluate any disease or injury that may be present for research or education purpose, that is known as post-mortem examination or autopsy or obductions. These three terms we can use simultaneously. Next question. The autopsy for non-human animals is termed as. The autopsy for non-human animals is termed as autopsia cadaverum, necropsy, obduction, none of this. The autopsy of non-human animals. Correct answer is Option B, necropsy. The autopsy for non-human animal is termed as necropsy. Next question. Following death, the subjective response experienced by the surviving loved ones is called. Following death, the subjective response experienced by the surviving loved ones is called grief, mourning, complaints, bereavement. Correct answer is option D, that is bereavement. Next question. Which of the following types of fluids are useful for DNA collection? Which of the following types of body fluids are useful for the DNA collection? Blood, saliva, semen, all of these. Correct answer, all of these. We can collect DNA from any of the body fluids, blood or saliva or semen. Sixth question. After how many hours of death does intraocular pressure become zero? After how many hours of death does intraocular pressure become zero? 24 hours, 2 hours, 1 hour, half an hour. Correct answer is option B, that is 2 hours. After 2 hours, the intraocular pressure become zero. So these are the important findings that is usually we can seen during post-mortem examination. Seventh question. When photographically documenting forensic evidence, it is considered good practice to capture. When photographically documenting forensic evidence, it is considered good practice to capture one image of each finding, two images of each finding, four images of each finding, at least 10 images of each findings. When photographically documenting forensic evidence, it is considered good practice to capture. Correct answer is option C, 4 images of each findings. Good practice means if 2 images also, someone we can take 2 images also, but it is considered good practice if we are taking 4 images of each findings. If there is a wound or something which leads to death of the person, so we need to take 4 images of that particular findings. That is a good practice. Eighth question. After death, during fundus examination, the fundus of the eye showing phenomenon of trucking. Phenomenon of trucking, that is known as phenomenon of trucking, or it is known as segmentation of the blood vessels. Options: keratosis, necrosis, Kevorkian sign, Mendelian sign. After death, during fundus examination, the fundus of the eyes showing phenomenon of trucking is known as keratosis, necrosis, Kevorkian sign, Mendelian sign. Phenomenon of trucking means it is a segmentation of the retinal blood vessels. So here, correct answer is Kevorkian sign. The phenomenon of trucking is seen during fundus examination is known as Kevorkian sign. Kevorkian sign. It is a post-mortem change that occurs in the retinal blood vessels characterized by fragmentation of the blood columns in the retinal vessels. Normally, the retinal blood vessels filled with blood, but after the death, the fragmentation of the blood column, there is a separate fragmentation. One part of the blood column will be there in area, and another area there is another fragmented part like blood column we can identify during the fundus examination. That phenomenon is known as Kevorkian sign. Next question. The ligature mass of the hanging in the case of suicide usually will be the ligature mass of the hanging in the case of suicide usually will be oblique, non-continuous, usually above the level of thyroid cartilage. Horizontal, continuous, usually at or below the level of thyroid cartilage. Oblique, continuous around the neck, below the thyroid cartilage. Last option, horizontal, non-continuous at the level of thyroid cartilage. So the ligature marks commonly seen in the case of hanging. So here correct answer is oblique, non-continuous, usually above the level of thyroid cartilage. Oblique in the sense that ligature will be above the level of thyroid cartilage. So this is the thyroid cartilage Adam's of apple. So above the level of Adam's apple will be there the ligature mark, and it will be non-continuous. At the level of node, it will be discontinued. So it is like above the level of thyroid cartilage, non-continuous. Non-continuous means it is non-continuous at the level of node, and it is usually will be above the thyroid cartilage in the case of suicide. So please remember, in the case of suicide, it will be above the thyroid cartilage level and non-continuous and oblique type. So this is the typical suicidal hanging type. So above the thyroid cartilage, and this is the node position, and around the neck it will be there, and the level of node position it will be discontinued. Next question. Which of the following area sustains the most injury during a sexual assault involving penile penetration only? Which of the following area sustains the most injury during a sexual assault involving penile penetration only? Cervix, perineum, vaginal walls, posterior fourchette. So during the sexual assault case, physical examinations, the most common area, most injury area. So that will be at the level of the most injury at posterior fourchette. So during the sexual assault with penile penetration only means the most common area of injury will be posterior fourchette, and other area the labia minora, posterior fourchette, and fossa navicularis typically sustains the most injury during an assault involving penile penetration only. Important thing, if there is penile penetration only, there means the injury mostly may be in the area of labia minora, posterior fourchette, and fossa navicularis. While assaults involving digital or finger penetration means there will be damage to this labia minora, posterior fourchette, and fossa navicularis, and apart from that, the vaginal walls, cervix, and perineum. And usually it is because of the fingernails, the injury because of fingernails. So in the case of penile penetration, the area labia minora, posterior fourchette, and fossa navicularis. In the case of digital penetration or finger penetration, the area may be labia minora, posterior fourchette, fossa navicularis, vaginal walls, cervix, and in the perineum also. 11th question. Injury to the neck muscles usually seen during the post-mortem victim of. Injury to the neck muscles usually seen during the post-mortem victim of hanging, strangulation, drowning, all of the above. Injury to the neck muscles. So injury to the neck muscles usually seen in the case of strangulation or the murder with strangulation. So in that case, usually injury to the neck muscle will be visible at the time of post-mortem study. In the case of hanging, there will not be injury to the muscle. That is the important finding, differences from hanging and strangulations. Hanging, injury to the muscles usually will not be there. In the case of strangulation, injury to the muscles will be there. So here answer is strangulation. Then 12th question, the gradual decrease in body's temperature after death is called. The gradual decrease in body's temperature after death is called stiff mortis, alger mortis, rigor mortis, liver mortis. Correct answer is option B, alger mortis. The gradual decrease in body temperature after death is known as alger mortis. Next question. During the postmortem, the neck cavity is examined at. During the postmortem examination, the neck cavity is examined at the beginning, in the middle, in the end, any time of during postmortem. During the postmortem, the neck cavity is examined. Correct answer is option C. The neck cavity should be examined at the end of the postmortem findings. The neck should be examined at the end of the autopsy following removal of all other organs, including the brain, so as to create a dry, bloodless field to minimize the possibility of introducing blood seepage into the neck structures during dissection. So I already told during the hanging and strangulation, the main difference is injury to the neck muscles. So these findings and all, if you need to get, means we need to do, or we need to examine the neck cavity at the end of the postmortem examination. So otherwise we will not get the clear picture of the neck cavity because of the blood bleeding at the area. So that is why neck cavity should be examined at the end of the postmortem examination. 14th question. Stiffness in the body that occurs after 2 to 4 hours after the death is called. Stiffness in the body that occurs after 2 to 4 hours after the death is called livor mortis, alger mortis, stiff mortis, rigor mortis. It is easy question, so everyone can answer here. So correct answer is option D, rigor mortis. Stiffness in the body that occurs after 2 to 4 hours after death is called rigor mortis. Alger mortis we already discussed, that is gradual decrease in the body temperature after death. That is known as alger mortis. Livor mortis means the blood will go into the dependent part or lower part of the body due to gravity. So that is known as livor mortis. Livor mortis means gradual moving of the blood into the lower or dependent part of the body after death is known as livor mortis. Livor mortis is due to gravity, and alger mortis means gradual decrease in the body temperature. Rigor mortis means stiffening of the body. And rigor mortis, usually the stiffening of the body, there is some process. First is primary relaxation, then rigor mortis, then secondary relaxation. These are the 3 steps involved in after the death. Then 15th question. When hanging is called typical hanging, the knot of the rope will be at. When hanging is called typical hanging, the knot of the rope will be at nape of the neck, mastoid process, thyroid cartilage, hyoid bone. The hanging is classified into 2 types, that is typical hanging and atypical hanging. When it is called typical hanging, the knot of the rope will be at. So correct answer is nape of the neck. When hanging is called typical hanging, the knot of the ligature will be at nape of the neck, that is below the occiput region. So knot will be at nape of the neck, and if there is the knot of the neck, the knot of the ligature other than the nape of the neck, that type of hanging is called atypical hanging. The knot of the rope other than the nape of the neck is called atypical hanging. The most of the all around majority 80 to 90 cases of suicidal hanging will be atypical example of atypical hanging. So that will be usually at the any side of the neck or face. The knot will be at mastoid level. Usually, that is a commonly seen hanging type. So that is an example of atypical hanging. 16th question. When the body is suspended on ligature on the neck and some body parts are touching the ground or other article is termed as. When the body is suspended on ligature on the neck and some of the body parts are touching the ground or other article is termed as complete hanging, partial hanging, incomplete hanging, both partial or incomplete hanging. When the body is suspended on ligature on the neck and some of the body parts are touching the ground or other articles is termed as. So here correct answer is option D. If body part is touching anywhere, either in grounds or any table or any other articles, it is known as incomplete or partial hanging. So another type of classification of hanging, that is complete hanging and incomplete or partial hanging. In complete hanging, the body will be suspended on ligature and any of the body part will not touch on the ground or any other articles. That kind of hanging is known as complete hanging. And at the same time, the patient is on the body part is suspended on ligature, but some body parts touching on the ground or any other articles, then it is called partial or incomplete hanging. So two types of hanging, two different classification we learned here. So that is according to the complete or incomplete hanging, according to the hanging type. And other type we learned typical and atypical hanging, that is based on the knot position. If knot is located at the nape of the neck, it is called typical hanging. At the knot is located anywhere else from nape of the neck is known as atypical hanging. So there is another case of hanging. In the case of hanging, the knot of ligature may be plus the cervical sympathetic ganglia on that side leads to the eye on that side may remain open and the pupil is dilated. This feature is known as. In the case of hanging, so this is an example of the question. So in the case of hanging, the knot of the ligature may be pressed the cervical sympathetic ganglia on that side, and which leads to the opening of the eye on that side and dilation of the pupil. This phenomena or this feature is known as because of compression of the cervical sympathetic ganglia of the body due to the knot compression, which leads to the opening of the eye on that side and dilation of the pupil. The opposite side will be closed. So options are asphyxia syndrome, hanging death syndrome, lay facie sympathic, all of these. So correct answer is option C, that is lay facie sympathic. Lay facie sympathic means due to hanging, the cervical sympathetic ganglia will be compressed due to the knot and the eye of that side will be open and the pupil will be dilated. That feature is known as lay facie sympathic. And another question, abduction fracture of greater horn of the hyoid bone is usually seen during postmortem finding in the case of. Abduction findings of greater horn of the hyoid bone is usually seen during the postmortem findings in the case of hanging, strangulations, blunt trauma on the head, road traffic accident. Important term is abduction fracture of greater horn of the hyoid bone. So this condition or this abduction fracture is seen in the case of hanging only. Strangulation, abduction fracture will not be there. In the case of hanging, it will be abduction fracture. And next question, in a homicide, a suspected person or criminal guilty of crime is hanged by a crowd by forcefully to a tree or lamppost is known as. In a homicide, a suspected person or criminal guilty of crime is hanged by a crowd by forcefully to tree or lamppost is known as hanging, lynching, strangulation, severe punishment. So we can see in newspaper and all, a mob or a crowd, they will punish the guilty persons by hanging. So this kind of hanging is known as. So here correct answer is option B, that is lynching. In a homicide, a suspected person or criminal guilty of crime is hanged by crowd by forcefully to a tree or lamppost is known as hanging, lynching. The next question, that is one interesting question. Autoerotic hanging is also known as. Autoerotic hanging is also known as sexual asphyxia, asphyxiophilia, hypoxiphilia, all of these. Autoerotic hanging. Autoerotic hanging means the practice of sexual self-stimulation while causing oneself to experiencing hypoxia, which is believed to be heighten the sexual experience. To get a sexual experience from hypoxia, that is known as autoerotic hanging. So correct answer is all of this. Autoerotic hanging is also known as sexual asphyxia or asphyxiophilia or hypoxiphilia. We will check the details here. Autoerotic hanging is also known as sexual asphyxia, asphyxiophilia or hypoxiphilia, or another term is Kurzweinism, and or autoerotic asphyxia or hypoxyphilic behavior. These are the terms used instead of autoerotic hanging. So please learn sexual asphyxia, asphyxiophilia, hypoxyphilia, Kurzweinism, autoerotic asphyxia or hypoxyphilic behavior are other terms for autoerotic hanging. Autoerotic form hanging is a form of sexual paraphilia where a person is often dressed in a female attire. Usually the male person will do. That is why the person is usually dressed in a female attire and asphyxiates himself with a ligature with some form of mechanism. So this with that they will get a sexual satisfaction. So it is a kind of sexual paraphilia, and they will do it for sexual satisfaction. But in that case, they may get death. They will die because of accidentally. They will die because due to the longer time of hypoxia, they will die. So death is usually due to accidental because it is doing to get to sexual pressure and accidentally the person will die. 21st question. Dribbling of saliva, lay facial sympathetic, blisters, etc. are seen in the case of dribbling of saliva, lay facial sympathetic, blisters, etc. are seen in the case of blisters means that is at the level of ligature mark. Dribbling of saliva means in the post-mortem findings we can find out dribbling of saliva in any of the side. If note is in the right side, the dribbling of saliva will be opposite side. The note is in the left side, the dribbling of saliva through right side. So that is related to dribbling of saliva. So dribbling of saliva, lay facial sympathetic also we discussed in previous question. That is due to the sympathetic ganglia compression of by knot. The that side eye will open and pupil will be dilated. That phenomena is known as lay facial sympathy. So these three cases are seen in the case of antemortem hanging, post-mortem hanging, both case, and none of these. Antemortem hanging in the case that is usually suicidal. Post-mortem hanging means that is usually murder. The person will murder other person and they will hang the persons to create a suicidal like situation. So that is called a post-mortem hanging. After the death, the body will hang. So these three cases, dribbling of saliva, lay facial sympathetic, blisters are seen in the case of antemortem hanging only. Post-mortem hanging in the case of murder and hanging the body means we cannot see dribbling of saliva, lay facial sympathetic, and blisters. Blisters in the area of ligature mark. These features we cannot see in the case of post-mortem hanging. So these are the main features to identify whether it is suicide attempt or murder. And so antemortem hanging, dribbling of saliva, lay facial sympathetic, blisters. 22nd question. In a post-mortem finding, the flattening of the muscles which are in contact with the surface is known as. In a post-mortem finding, the flattening of muscles which are in contact with the surface is known as rigor mortis, contact flattening, secondary relaxation, primary stiffening. Correct answer is option B, that is contact flattening. If patient is in supine position means the dead body is supine position means the muscles, mainly the gluteus muscle become flattened. So that is known as contact flattening. Correct answer, contact flattening. Flattening of the muscles which are in contact with the ground or surface. 23rd questions. Orders of appearance of rigor mortis to voluntary muscles starts as per Nistens law from. Orders of appearance of rigor mortis to voluntary muscles starts as per Nistens law from. Muscles nearer to brain, muscles nearer to heart, muscles of lower limbs, muscles of upper limb. So Nistens law states that some kind of order will be there for rigor mortis in the case of voluntary muscles. That is chart from. So correct answer is the muscles near to the brain. The rigor mortis of the voluntary muscles occurs as per Nistens law, that is started from muscles near from the brains. So eyelid muscles will start first, then neck, then jaw muscles, like that it will go. 24th questions. Which of the following statement is true regarding rigor mortis? Which of the following statement is true regarding rigor mortis? At cold temperature, rigor mortis comes early and passes off early. At high temperature, rigor mortis comes early and passes off early. Both high and extreme cold temperature, rigor mortis comes early and passes off early. At normal temperature, rigor mortis comes early and passes off early. So you need to find out which statement regarding rigor mortis is true. So here the option B, at high temperature, rigor mortis comes early and passes off early. In the process of rigor mortis, it will start from 2 to 4 hours and it will complete rigor mortis or stiffening of the body will complete at the end of 12 hours. Then it gradually, the rigor mortis will reduce, the stiffening will reduce and it will go to the secondary relaxation. So while discussing the early first questions, I told the rigor mortis have some process. So first will be primary relaxation of the muscles. So that time there will be 100% of ATP available in the muscles. Then second process is rigor mortis, stiffening of the body process. After the rigor mortis, around 12 to 24 12 to 36 hours, the rigor mortis gradually will reduce. Then secondary relaxation will start. So up to 48 hours, the secondary relaxation will finish. So this is the process. So some situations will stimulate the rigor mortis. So one of the main thing is temperature. High temperature. High temperature increases the speed of rigor mortis. And if it is rigor mortis occurring fastly, means it will go off fastly also. If rigor mortis occurring slowly, it will the relaxation will also occur slowly. So that is the process. In cold temperature, rigor mortis occurs very slowly, and that is why it will the stiffening will reduce. In secondary relaxation, that also will be slow. So correct answer is high temperature rigor mortis comes early and passes early. So there is a law, rule of 12. The first 12 hours, rigor mortis will complete. Next, second 12 hours, the rigor mortis gradually will the rigor mortis will sustain, and the third 12 hours, the rigor mortis will finish. That is the rule of 12 regarding rigor mortis. Then 25th question, cadaveric spasm is also known as post-mortem spasm, instantaneous rigor mortis, cataleptic rigidity, all of this. So correct answer here, all of this. Cadaveric spasm is also known as post-mortem spasm or instantaneous rigor mortis or cataleptic rigidity. So we will discuss it here. Cadaveric spasm also known as post-mortem spasm, instantaneous rigor mortis or cataleptic rigidity or instantaneous rigidity. That means it is a rare form of muscle stiffening. It is a rare form of muscle stiffening that occurs at the moment of death. That is the important thing. Cadaveric spasm or post-mortem spasm that occur at the moment of death. I already told you, first process is primary relaxation immediately after the death. In the case of cadaveric spasm, the stiffening that occurs at the moment of death. There will not be primary relaxation. So that is known as cadaveric spasm. The stiffening that occurs at the moment of death and persists into the period of rigor mortis. So instead of primary relaxation, there will be stiffening and it will go into the second process of rigor mortis. And the third stage, the secondary relaxation, that will be there. And 26th question, the scientific study of death and practices associated with it is known as. The scientific study of death and practices associated with it is known as forensic medicines, criminology, thanatology, postmortem studies. The scientific study of death and practices associated with it is known as thanatology. Correct answer is thanatology. Scientific study of death and practices associated with it is known as thanatology. Okay. Next question. Harvard criteria is used for assessment and confirmation of. Harvard criteria is used for assessment and confirmation of somatic death, brain death, cellular death, clinical death. Harvard criteria is used for the assessment and confirmation of brain death. So Harvard criteria includes cold calorie test and all, including Harvard criteria. First, the reflexes will be absent and there will not be any movement when giving pain stimuli, and this and all included in Harvard criteria for assessing brain death. And next question, the hot nose sign. The hot nose signs refers to increased perfusion in the nasal region on nuclear medicine cerebral perfusion studies, which is usually seen in. The hot nose sign refers to increased perfusion in the nasal region on the nuclear medicine cerebral perfusion studies, which is usually seen in. So while doing perfusion studies after the uh, uh, after some this following condition, there will be increased circulation to the nose. That will give a hot nose sign. So we can see in which case. So options are brain death, asphyxial death, drowning, hanging. So correct answer is brain death. After the brain death, the internal carotid artery circulation will be gradually reduced. So this blood flow will go into the external carotid artery, and most of the blood will we can identify during the cerebral perfusion studies into the nose. So that sign is known as hot nose sign. After brain death, the internal carotid artery circulation will reduce and the external carotid artery circulation will increase. So most of the external carotid artery circulation will be we can see during the cerebral perfusion studies at the nose. So that sign is known as hot nose sign. So next question, that is Harvard criteria for brain death include all of the following except. So in previous question, I have discussed some criteria. So here you need to find out which criteria is not included in Harvard criteria for brain death. The options are unresponsive to pain stimuli, absence of breathing, absence of reflexes, absence of electrical activity in ECG. Harvard criteria for brain death. So here correct answer is absence of electrical activity in ECG. That is not included in Harvard criteria because electrical activity is not there, means it is indicating the functioning of heart is not occurring. In Harvard criteria, we are assessing the functioning of brain. So in that case, there will not be no response in the case of pain stimuli, absence of breathing will be there, and absence of reflex will be there. And to confirm the brain death, the same test will repeat after 24 hours. So both test giving same unresponsive to pain stimuli and absence of breathing, absence of reflexes means that time only we can diagnose as brain death. So last question, the executive magistrate are appointed by. The executive magistrate are appointed by High Court, Supreme Court, state government, central government. Correct answer, state government. The executive magistrate are appointed by state government. Most commonly, Tahsildar, district collector are the examples of executive magistrate. They have the power of execution, means some administrative powers, and this is lower level of magistrate level. So these officers are appointed by state government of particular region. So that is about 30 questions regarding forensic nursing. So these are the questions, very fresh questions, and this forensic nursing is added in our curriculum. So these questions will be very important in coming examinations. So please learn these terms and these conditions, and you will get more questions in from our Android app, the Nurse Academy. You can go it and check it. So thank you. Thank you for watching this video, and please like and share, and please inform your friends also because it is a new topic, and inform your friends, those who are preparing for upcoming examinations. Thank you.